Doctors, what's the most outrageous self diagnosis that you've heard from a patient? Story 1. I had a patient come in once due to weight gain that she thought was due to being pregnant. It made sense, except she'd taken more than half a dozen pregnancy tests and they were all negative. She was convinced she was pregnant though, and wanted me to check. I told her, okay, I'll do a blood test since we can detect pregnancy earlier with that. And she refused. She said that she just wants to take a whiz on the stick in front of me and have me read it. So I said sure, and lo and behold, it was negative. After a little more questioning, it turns out she'd been eating literally nothing but chicken wings for weeks. When I asked her why in the world she would do that, she replied that she just really liked chicken wings. After taking a moment to process what she said, my response was, well, me too, but because chicken wings are pretty great, I can't deny it. This doctor likes chicken wings too? Then I guess he's probably pregnant. Congratulations. Story 2. I'm a veterinary student. I've had some dude with a super aggressive dog diagnose the poor thing with neural instability, causing his aggression, from an online consultation with a homeopathic shaman. He then came into the clinic with instructions from the shaman that he wanted the vet to carry out, including rubbing the dog all over with a $200 healing stone, even though the vet obviously had a more reasonable explanation. He didn't want to believe leaving the dog in the backyard without much human or animal interaction for most of its life could cause aggression. Go figure. I have another story. A lady was convinced her cat was hyperthyroid and just wanted to start taking medications. We went round and round with her. We did the smallest blood panel we could for diagnostic purposes. The CBC comes back and the cat is severely anemic and in need of a transfusion. And it's probably got mycoplasma. The owner never came back for meds and the cat passed away a week later. Story 3. I'm not a doctor, but I've been a crazy patient. Earlier this year, I had a conversion disorder, which, for those who don't know, is when a person develops a disease and presents symptoms, but the whole thing is actually taking place in their heads and they're fine. Within several weeks, I systematically lost my ability to walk and was terrified. I saw a series of doctors and they theorized everything from MS to ALS, so I was pretty sure I was withering away and ended up in a hospital. But by this time, I was starting to doubt myself. My reflexes, MRI, and other tests had all come back normal, and I could do things like jump but not walk. Finally, on my first night in the hospital, I spent several hours convincing myself that I was making it all up, that my family and loved ones would forgive me if I just made it all go away, and that it would be okay. So I got up to the bathroom, and I was fine. This experience still haunts me as the single most embarrassing and humiliating thing that I've ever done, even though I thought that it was real. Even though it was months and months ago, I feel bad daily for scarring my family and friends and for wasting so many doctors' time. I'm glad that I discharged myself from the hospital before they had the opportunity to run any more tests. The one saving grace of this whole thing is that I was able to realize pretty quickly that it wasn't happening. I had to see a therapist afterwards, and he told me that usually, conversion disorders stretch on for months in that the patient will be completely convinced that it's real despite all evidence to the contrary. He told me about this one woman he treated who became paralyzed following a traumatic event in her life. It was so real to her that doctors were able to run a series of tests and she would show no pain response. Eventually, she recovered, but it took several months and she had to use a walker and stuff for a while. It's scary what the brain is capable of. Story 4. I'm not a doctor, but I work in the neonatal intensive care unit. One night, we were called to labor and delivery for a preterm delivery. The patient called 911 because her stomach hurt a lot. At the hospital emergency room, it was confirmed that she was pregnant and in labor. The whole time we were there, she kept saying she felt that the end of her life was near, and she didn't understand why we wouldn't help her. The OB kept telling her that she was in labor and to push each time she felt pain. She kept yelling, "It's just gas. I've had gas for a while, but it won't come out." Fast forward, and the OB hands the baby to the nurse and then shows the patient her baby. The patient says, "That's not mine. I have gas." The nurse places the baby on her chest and says, "Well, here's your gas. It's a boy." The baby was not left on the patient's chest. The nurse was just showing her the baby. The baby came to our team on the warmer so we could assess him. He was breathing fine, crying, and picking up well. He weighed just over 5 pounds, so the baby went to the nursery instead of with us. In hindsight, the patient was not that large, slightly curvy, and not showing much. Her age was mid-20s from what I remember, and she was single. Social workers and CPS were obviously involved. Her family was called with their permission. After that, I don't know what happened to them. I can't blame her. Some people think their kids are full of crap. Check the patients in Story 8. I can't help but feel sorry for them. Story 5. I had a woman once who was convinced that someone was trying to steal her Clonopin, so she ate all 45 of them. We tried to get her to drink activated charcoal so that we wouldn't have to lavish them out. She fought us over that because now we were the ones trying to steal them from her. That was on an ER rotation in paramedic school. Another was the woman who swore she was having a heart attack despite not having any symptoms at all. We did the EKG and full workup, which unsurprisingly came out completely normal. She insisted, so we transported her anyway. The ER ran all their tests and discharged her when they were clear. 3 hours later, guess who called? She's still convinced she's having a heart attack and wants to be transported to another hospital. She was politely told, no. I found out later that she calls once a week or so. Unrelated, but funny, was the old man who called us out because he couldn't find the TV remote and his son was asleep. Story 6. A guy came into the old ER one day with a wound in his hand from an accident. The nurse was checking him in and asked him to rate his pain on a scale of 1 to 10. He replied that it was only about a 3. We all looked at him like he was nuts because our pain was at a 5 and we were just looking at him. Plus, this was a charity hospital where 99% of the patients were sitting in bed, casually texting or chatting on the phone, but still rated their pains as 10 out of 10. You get the picture. So the triage nurse rolled her eyes and asked him how it could only be a 3. He responded by saying that one morning he was cooking his girlfriend breakfast. They were especially hungry that day when they woke up. Well, he says that when he bumped the pan and the hot bacon grease spilled onto him, that was certainly a 10 out of 10. So to him, his wound at the time was only rated at a 3 out of 10. Story 7. Obligatory, I'm not a doctor. We once had a patient come in who was convinced he had colon cancer. He was just constipated. Another was an overweight young woman who came in saying that she was pregnant and the baby was coming. We got her back quickly and started a set of vitals, and she was calm about the whole thing. It ended up that she was not pregnant at all, just crazy. An older gentleman came in complaining of headaches. During his history, he became agitated and kept insisting that the government had been experimenting on him by dusting his house, food, water, etc. with anthrax. He was quite certain that there was anthrax in his brain because he could see it in the back of his throat. It turns out he just had an upper respiratory infection. So, the same thing, I guess? That gentleman must have had really clear vision to see an infection in his vein through his throat. Story 8. As an entomologist, I get 1 or 2 people come up to me every year claiming they have some kind of infestation. These people are convinced some parasite is in their skin, so when the doctor tries to tell them they need a psych referral, they take it badly. They ended up coming to me to identify the parasite. These are really unfortunate cases. Onset is often paired with a tragic life event, so you'll hear things like, when I was cleaning out my dearly departed husband's closet, I became infested. They will go to great lengths to attempt to purify themselves and establish elaborate decontamination rituals. These people often isolate themselves for fear of spreading the parasite, and as a consequence, they often end up homeless. I have a good relationship with my local dermatology clinic, so I send them there. They treat the patient with respect and, while investigating the parasite, slowly lure them onto anti-anxiety and antipsychotic medications needed to stop the delusion. Interestingly enough, they will stop believing they are currently infested when on the right psych pills, but will still insist that they were infested before. It works like this. The parasite you described seems like a serious problem for you. Never validate the delusion. We'll keep looking into the parasite. In the meantime, I know this is very stressful for you. So why don't I give you something to help you relax? Over several appointments, the patient is put on the medication, and hopefully, the delusion stops. The problem here is that the patient will not listen to you or work with you if you hint at it being a psych issue. If you flat out told them exactly why they were being given the medications, they would refuse. In their minds, they aren't crazy. They truly believe parasites are infesting them. Story 9. I once had a girl who said she had which was coming and going, and then she said she had zits on the back of her tongue. I looked, and it was her taste buds. There were no other lesions to be seen. I told her that primary lesions almost always cure completely, so if those ulcers are appearing and disappearing every once in a while, it was very unlikely. By that point, she had gotten a lot more relaxed. The consultation went great, and she went home feeling a lot better. Still, I made her get an panel because she was active, young, and in doubt about her partner. I had her get an panel, and it came back positive for VDRL and TPPA. She picked up the results and then went to the follow-up consultation with me. On the next consult, she shows up saying, "Doc, I think I do have." She did. I learned a valuable lesson that day. The cool thing was that she wanted to do her treatment and follow up with me because she told me she had seen a lot of people before me, but no one bothered to check. Story 10. My dad is a physician. He's got a lot of great stories. This is from memory. If anyone is interested, I can ask my dad about a few more stories, but my favorite is when a little old lady who didn't speak English came into the clinic with a live chicken. She claimed the chicken had the spirit of her dead husband in it and it was giving her nightmares. She told the check-in desk that she wanted to talk to the doctor about what to do. So my dad, the only guy who speaks Spanish at the moment in the clinic, listens to her and doesn't quite know what to do. He asks the lady if she tried getting rid of the chicken. The lady says no, she doesn't want to get rid of the chicken. She wants to keep it alive because it has become a pet. She tells my dad she wants the doctor to cleanse the chicken of her husband's spirit so he can rest in peace and she can stop having nightmares. My dad tells her he doesn't think he has anything to fix that particular problem and asks if she's tried anything already. At the time, he is working on a reservation in the Southwest, and traditional healing practices tend to take place alongside modern medicine. She says yes, but it didn't work. That's why she went to the clinic. She said thank you and left with her chicken. Too bad this dad wasn't able to perform an exorcism. I'm sure you're cracking up with the stories you've watched so far, right? If you want to keep watching crazy stories like these, like the video and subscribe to my channel. There's more where that came from. Story 11. Well, it's not the self-diagnosis per se that is the most interesting thing about this, it's the bits after. I had an elderly woman come in after having a stroke. After we treated her, she believed she still suffered from symptoms. We had to give her face-saving therapy. That's where the patient believes they're getting better, even though there is nothing wrong with them to begin with. She stayed in the outpatient department for a few months and eventually went home with her daughter. This is where it gets interesting. Apparently, she was the mother of some big-time Mafia guy, and she conspired with her brother-in-law to have her son eliminated. When the son found out, he was going to do something bad to his mother, but she luckily had a stroke, which put her in my care to begin with. She was scared of leaving the hospital because she thought her son might come after her if she did. Eventually, she passed away from another stroke a few seasons later. Story 12. A dentist here. A 27-year-old patient comes in with his mother. The mother is on disability. The patient has large amounts of cavities on every single tooth in his mouth. The kid absolutely will not even listen to having his teeth pulled and dentures placed. Public health office, so most are uninsured or of low financial status. Really should have most, if not all of them, pulled. He agreed to do a mock-up treatment plan which came out to roughly $4,500. That's with a sliding fee discount of 50% for the lowest financial level. They agree to pay, and mom plucks $800 cash down for the root canal to start off. I asked what happened for his teeth to get that bad. The stupidest answer I've had yet. A dentist before told me to mix dollar store mouthwash with peroxide and rinse with it. It wrecked my teeth afterward. Mother agrees and swears that the same thing happened to her husband. The older brother is getting all of his teeth pulled as well. What messed his teeth up was a lack of care and what looked to be a serious soda habit. Story 13. As a vet tech assistant, I work overnights, and usually I clean, check the vitals of patients, and answer phones. I picked up a call at about 2:30 in the morning. This woman is convinced her dog has bloat. While that sounds benign, there's one kind of bloat where the stomach twists and cuts off circulation from the stomach. It is deadly if not caught quickly. Other kinds are treatable, but when you look up dog bloat, you're going to find the most fatal one first. I ask her what makes her think her dog has bloat. She tells me her dog ate a piece of steak and started acting more sleepy, and his stomach was a little bloated. She looked that up on PetWebMD and it told her dog had bloat. I go through the symptoms of GDV and she says no to all of them except the bloated stomach. I give her the price to get an emergency exam and she suddenly stops freaking out, thinks it's not a big deal, and hangs up. She never came in for an exam. Story 14. I'm a nurse in the ICU at a major teaching center and I had a patient's daughter tell me her dad is allergic to potassium because she is. At this point, I'm trying to keep a straight face and not laugh. I asked her why she thought she was allergic to potassium, and she explained that she had a bad reaction last time she was in the hospital. I asked if the reaction was pain at the IV site, and she said yes. I tried to explain that everyone has this reaction, and it is not an allergy. I then told her that her dad was not allergic, and that it is not possible to be allergic to potassium since we require it to live. She then keeps going on and says she doesn't want her dad to get any because of her reaction. At this point, I am losing patience with her and tell her that her dad is fine as he has been receiving potassium with no reaction. She starts yelling and demanding to speak to the intensivist only, not the residents. So I went to get the intensivist just to try and calm her down. He comes in and tells her everything I said is true, and he doesn't have time for her voodoo crap, so she needs to calm down and let us care for her dad, who is on life support. Hilarious. Potassium is needed by our bodies. Why do patients visit doctors when they don't listen to them? Story 15. Dentist here. I had a patient come into my office, certain he only had gingivitis and needed a normal cleaning. All because he had Googled his symptoms and believed he could get a normal clean and go back home and do oil pulling after, which would somehow miraculously heal his gums. He would not allow me to take x rays or deep clean his teeth, which he needed because plaque was formed well below the gums. He even told me his gums were bleeding from just smiling, moving his mouth, etc. He insisted on just a regular clean and then accused me of trying to make money off him when I put my foot down and said I wouldn't be working on his mouth unless he allowed me to do my job properly. I was glad when he decided to walk out and never come back. Story 16. My sister keeps diagnosing me with endometriosis, polycystic ovaries, and another one I can't remember. She gets furious with me for not going to the doctor because I don't care about my health and I'm sticking my head in the sand, etc. My only symptoms are irregular periods and normal cramps or fatigue when I'm on my period. But apparently, cramps aren't normal, and neither is wanting to eat chocolate or take a nap. It's gotten to the point where I literally cannot say a single word about my health in any way, shape, or form without her jumping on me. And no, she's not a doctor. She does have endometriosis and PCOS, which apparently qualifies her to diagnose me. Story 17. I'm a fourth year medical student, so I don't have the MD title yet, but during my pain management rotation, I had a patient tell me that he had Hep C. When I asked how he got it, and when he was diagnosed, he told me a doctor on 4chan diagnosed him a few months back after his friend told him he got cancer from too much internet usage. I kid you not, it took me all the power of God not to burst out laughing. But then he continued to go on about how he's helped his friends out with medical advice through 4chan and how he doesn't trust WebMD or Google for medical advice because they're owned by the man and only good at making people believe they have hypochondriasis. So long story short, he didn't get the oxycodone he was hoping to get from his consultation and made a giant fuss about how we're only making his Hep C worse by not giving him meds. Story 18. Nobody really wants to be responsible for their obesity, so people Google diseases that could be causing them to gain weight. My favorite was a lady who insisted she had Cushing's disease, what people mean when they say they have a glandular issue. She wasn't. It's rare, and there are some classic signs that normal obese people don't have. So I went through an exercise where we discussed all the food she ate during a typical day. We hit roughly 3,000 calories before finishing what she typically eats for lunch. The conversation never goes well from there. There is nothing that I can prescribe for denial. Yep, seems like that is one of the hardest diseases that doctors usually have to treat. Denialitis. Story 19. Not a diagnosis, more like anamnesis. The woman, 83, complains about severe headaches and vertigo. After putting her on the monitor, we saw that she had a blood pressure of 190/90, and I asked her if she was taking any medication. She starts rummaging in her purse and pulls out an unopened box of antihypertensives. So, did you just stop by the drugstore and get a new box, or why haven't you taken any of these? Her response, no, I got this directly from my doctor. Me, so why haven't you taken any? Her, oh no, young man, what comes from alone will go by itself. Story 20. I worked the night shift in the ER for a few years, and this little old lady was brought in one night. She didn't have a kneecap in one of her knees, removed for some reason, and she'd gotten up in the middle of the night to take a leak. Well, her knee gave out and she fell back against the wall, which wouldn't have been too bad except she broke the toilet paper holder when she fell. She was stuck there. She pressed her life alert, and the ambulance guys and maybe a fireman, I'm not sure, got her off it and brought her in. She told us all what happened and ended her story with, I felt much better after they got me off the wall. It looked like she'd been bitten by a giant spider. Story 21. My elderly friend is the queen of self-diagnosis. She tells the doctors her prognosis and rarely follows through with their treatment for her actual issues. My personal favorite is that she produces too much electricity. Because of this, she has issues with anything electrical, specifically computers, cash registers, pin pads, and my personal favorite, gas pumps. She is afraid she will blow up the pump, so I fill her tank for her. In reality, she is confused by technology and never wears her glasses. She was recently put on vitamin D pills because she rarely goes outside. Her house is a black box inside. I'm afraid to find her wrapped in foil one day. I hope you enjoyed this video. And if you made it this far, I'm sure you'll also enjoy Doctors Who Were Your Dumbest Patients. Story 4 is hilarious. See you on that video.